Hi, good afternoon, everyone. A very warm welcome for joining our Facebook Live section. First and foremost, I would like to introduce myself. My name is Felicia from Bagan Specialist Center Marketing Team, and I will be your host for today's program. I'm great to invite Ms Kang Jia Yi, our clinical psychologist of Bagan Specialist Center, to share with us 3 series of back to work webinar for working adults on the way to cope with COVID-19 stress on every Friday 4 o'clock. Today, Ms. Kang Jia Yi will share the second series. The topic today is developing resilience toward repression. If you have any question to ask, please feel free to raise the question in the Facebook post column. Now, please allow me to welcome Ms. Kang Jia Yi to start her talk. Over to you, Ms. Kang.
Good afternoon, everyone. My name is Ms Kang Jia Yi, and I'm a clinical psychologist at Bagan Specialist Center. If today is your first time tuning in, it's fine. This is the second topic of this series of webinars that we have been hosting. So basically, today we'll be focusing more on depression and how we can learn how to develop resilience towards it, because it's always prevention before cure. So thanks for tuning in today, and I'll just go ahead and start today's topic. So basically, we will understand what depression is, how it's like. We want to learn to recognize some of the signs and symptoms just to see if some of us might be experiencing it, or we have family members or friends who may feel like are experiencing it. Okay. Then we'll also talk about resilience in terms of our thoughts. Cognitively, it means how we are thinking and how we can strengthen our thoughts to face depression, or to prevent from developing further into depression. We'll also talk about some simple coping methods that all of us can easily do. And last but not least, we will also be talking about how, as a person or as a friend or as a family member, if you do have someone close with you whom you feel like struggling, how do we provide some form of support? Okay. So before we will go into the technicalities about depression, most of us, when we talk about depression, we'll think of low mood. We'll always say that, oh, I've been feeling very low today. I've been feeling very low for the past week, or I've been feeling very emo for the past month, for example. Okay, so low mood is actually, yes, and it's an emotional state. It can be sadness, okay? It can also be disappointment. It can also be when we are demotivated. That makes us feel low when we generally say so. Okay, if we're just talking about low mood, it can be a very normal part of life at different stages of time, because life, we have different emotions. We have happy emotions. We have lower kinds of emotions such as sadness. So it's unavoidable. There are times where we will feel sad, so it's very normal. Okay. But the thing with a general form of low mood is that it will often improve or resolve after a short period of time. For example, we made a mistake today, or something didn't go well today, so I'll feel low for today. But if it's just a normal form of low mood, then maybe it will go away after the next day, or after a few days, or in a week or so. Okay, so now we'll just talk about depression then. what is the difference between low mood and depression? When it comes to depression, it's actually also a very common mental health problem. Um, it is a mood disorder, and it is mainly characterized by persistent feelings of sadness. So when we're talking about persistent, it means prolonged, for a long period of time. So earlier when we were talking about low mood, it was over a brief period of time, isn't it? So for depression, it occurs, and we can label or start to analyze if it is depression when that low mood is starting to last longer than it's supposed to be. For example, more than 2 weeks. Okay, and apart from this prolonged feeling of sadness as well, normally it will be accompanied by loss of interest and also pleasure. So meaning you might not be able to enjoy previously enjoyable activities as much as you do. Okay. And in order to be characterized as a mental health disorder or a mood disorder, it we will have to see whether it really does cause impairment in daily functioning. Okay, so let's just we can move forward to the symptoms in a bit, but just bear in mind, even depression itself will range from mild to severe symptoms. Okay. Okay, so these are actually a list of criteria to fulfill in order to be diagnosed with major depressive disorder, which is the technical term for depression. Okay, so as I mentioned, there'll be depressed mood or low mood. Okay, but the criteria is it has to be prolonged, meaning most of the day and for nearly every day. Okay, and of course with loss of interest and pleasure. And there'll be other changes in our physical functioning as well. So some might see a significant weight loss, okay, or some might see a significant weight gain. Okay, it might be due to loss of appetite or increase of appetite. Okay, and other physical changes are also such as insomnia or hypersomnia. Insomnia means that you can't, you have difficulties falling asleep. Okay, while hypersomnia means that you will be maybe sleeping much more than you used to. Okay, that might be a form of avoidance behavior. Okay, psychomotor agitation or retardation. So you can either be very irritable, okay, very agitated, very restless, or the opposite will be retardation, meaning fatigue and lethargy to the extent where you might not have energy to move. Okay, you might more be like in a very tired state. Okay. Okay. Now we will talk about some of the apart from sadness. Okay, what are some of the other feelings or perceptions that someone who is depressed might have? One of the very common feelings is feelings of worthlessness, meaning that you feel like you're not worth it, okay, or you'll be feeling excessively guilty about certain things or even about yourself. Okay, poor concentration can also come into play, okay, because imagine if we are sad all the time, or we are having changes in our sleep and in our appetite, in our energy level, so definitely our concentration will be impacted. Okay, we might have difficulties making decisions or going about our daily lives as how we used to be. And to more severe extents, some of the individuals might have recurrent thoughts of harming themselves or even death and suicidal ideation. But these are more severe, to the severe extents of depression. Okay, so that was the symptoms for depression that we've looked up, that I've mentioned earlier. So we'll just try to look out for that. Okay. All right. So another common question that, as a psychologist, I've commonly encountered with our patients is that a lot of people will ask, okay, how how does one develop a mood disorder or a mental health issue? Okay, so there's no clear reason or no clear factor. In fact, based on the biopsychosocial model, there are a lot of risk factors available. Okay, so biological factors can mean genetics. Okay, you might have a genetic predisposition, okay, to develop depression. Okay, let's say someone in your family has experienced an episode of depression before sometime in their lives. Okay, but that doesn't mean that having that genetics itself, it will lead you to develop a mental health issue. Okay, we also have psychological factors such as your own coping and your own resilience. Okay, in light of stress, how do you normally deal with problems? How do you normally solve your issues? Okay, and we have social and environmental influences as well, such as your education background, your interpersonal relationships, social norms, okay, how people react around you, or how have you been brought up by your family, okay. So all of these are risk factors that will come into play to contribute to the development of a mental health issue. But remember that by having one factor, it doesn't mean that you will definitely develop it. Okay, so for example, if you had a genetic predisposition, but if you have healthy relationships, healthy social support, and a good coping system, then you might not, develop depression, for example. Okay. All right. So now that we've talked about the symptoms and some of the factors, I'm going to just briefly cover what are some of the treatment that is available. Okay. So at this time, okay, in society, there's a lot of treatments available. So do not be afraid to reach out or to seek help for someone, someone you are close to, someone you love. Okay. In terms of treatment, first of all, there are psychotropic medications available, okay, to help with symptomatic relief. Okay, for example, if it's for depression, there are antidepressants that will help to increase your serotonin levels. It's a chemical, we call it a happy chemical in your body, it will help to increase that chemical, okay, that component, and sort of help you to lift up your mood and help you to go back to normal functioning. So sometimes medications can help with that, okay? And together with medications, therapy is often commonly prescribed together with medications, okay? Because medications provide symptomatic relief, meaning maybe it will help you to improve your mood, okay, or your motivation, okay? But therapy will also help you to explore on, say, current issues, okay, because your issues will still be there, okay? We'll explore on understanding yourself. It will help you to explore on past coping methods or past forms of thinking, and it will help you to develop, okay, healthier forms of thinking, healthier forms of coping, okay. And in the long run, this will also help to help a person to develop strength, mental and emotional resilience towards, future relapses. Okay. Okay. So without dragging on further, I'll just quickly jump into how do we actually build up our resilience? How do we build up our mental and emotional strength to deal with stresses, to deal with difficult events in life, and to help us to prevent ourselves from going down too far down the road? Okay. We will focus about our thoughts and our cognitions. Okay, as I mentioned earlier, it's all about cognitive resilience, cognitive and emotional resilience. So basically, if we're looking at this model, people's feelings, behaviors, and our bodily functioning, our physical functioning, are largely influenced by our own perception or our own thoughts of different events. Okay. Here's a clearer diagram for me to explain. For example, okay, in light of a situation, we have certain thoughts that are maybe a little bit more negative. Okay, say we think that, oh, you think that you didn't do good enough. Okay, so that will affect how you feel. Okay, if you think that way, then naturally maybe you will feel sad or disappointed or frustrated. Okay, then when that happens, we might react in different ways. Some of us might react negatively, such as losing confidence, or starting to avoid certain tasks. Okay, some of us might start to our performance might be impacted because our confidence is impacted. So we might start to perform mistakes, for example. Okay, um, then when let's say we avoid doing that task because we feel like we have failed, so we don't want to protect ourselves, we don't want to do it again. Okay, we are afraid of doing it again, so we avoid doing it. Okay, but the thing is, by avoiding that activity or that action, you're actually reinforcing your thought. You're actually strengthening your thought that, oh, hey, I didn't do well actually. And by not doing it also, it will pull down your performance, isn't it? Or your scores or whatsoever. And then it goes into a vicious cycle. So the more you think this way, then the more it will affect how you feel. And then it will continue to impact your functioning and your behaviors. Then it will continue to affect how we think, and it goes on and on. Okay, so this is how generally this thought model works. Now I have another few more examples. Okay, for example, you have already a deep set belief that you're incompetent, you're not good enough. Okay, so let's say there's a situation. You were praised or you were recognized by your boss or your supervisor on your achievements. But what happens is you start to think in a more negative way. Maybe you would think, but I didn't deserve it. Okay. So what happens is when you think this way, it will strengthen the core belief that yes, I am really incompetent. Okay, so another example, you have a new job, but maybe it's taking you a while to get used to it, or to pick up on your knowledge, for example, and you think that you're picking too slow. Okay, so if you're thinking this negatively, so again it will strengthen that main belief that you're incompetent. Okay, but on the other hand, if there is no, if that thought, there's no, not so much of a negative impression or negative perception there. If we look at it here, then it will sort of bounce back. Okay, there will be one incident where this belief that you're incompetent is not reinforced. Okay, does that make sense? Yeah, so this is just an example of how by having negative perceptions, especially towards our own selves, then how it continues to affect us emotionally and behaviorally, and how it continues to strengthen certain beliefs about our own abilities, okay, and about ourselves, and then we will just continue to be in that vicious cycle. Okay. So with better understanding of how our thoughts actually work, how it affects us, so mainly in order to develop resilience, okay, is to restructure our thoughts. Okay, so I'm sure a lot of us have had experiences where we confide in our friends, and our friends around us will say, hey, think positive, don't think negative. Okay, but the question is, how do you do that? It's easier said than done. Okay, so we'll talk about how actually theoretically how we're supposed to do it, okay, and how you can try it on your own as well. So there are three main steps. Firstly, we have to identify what those thoughts are. Okay, this is actually the most difficult part. Okay, because for us, I mean, it's a it's a bit conflicting sometimes for us to acknowledge that, hey, what I'm thinking about myself might not be true, or what I'm thinking about myself, may might be a bit too harsh. Okay, we are often very, very harsh towards our own selves. If you ask other people around you, they might think that, hey, you didn't do that bad, what? But normally we ourselves think that we did very poorly. Okay, so and the thing with thoughts is that it's often very fleeting. It goes by very fast. It comes and go without us even realizing it. And especially if we've been thinking negatively for a long time, so it's become a habit. When something happens, we will start to think negatively about ourselves. So, which is why I mentioned this is the most difficult part. How do we identify? Okay, but once we're able to do that, then it will be good to learn how to evaluate those thoughts. Okay, and then to change them. Okay. So, to identify, here are some common unhealthy thinking patterns, okay, that I will go through. Okay, we have a very common one, which is black and white, thinking in black and white only. There's no gray area, there's no middle ground. Okay, so basically, if you don't do it, then that's it. Okay, so there's no like a 50% point. It's either with 0% or 100%. Okay, then we have fortune telling. We are all human beings, but for some reason, all of us like to sort of, try to foresee the future to a certain extent. We try to, we want to be like superheroes, and we want to try to think, what's going to happen tomorrow, what's going to happen if I don't do this, what's going to happen if I don't do that. So we tend to overthink. Okay, and we will then make certain assumptions about ourselves, like I'm definitely going to fail. Okay, but you don't even know. Okay, then we tend to label ourselves as well. Okay, like I'm a bad person, I'm a lousy mother. Okay, we, as I mentioned earlier, we tend to think and see negatively about ourselves more than other people sees us that way. Okay. One of the last unhealthy thinking pattern that I'm going to share here is tunnel vision. Tunnel vision, as the name implies, meaning your viewpoint is very narrow. Okay, you only look at one viewpoint, but sometimes we fail to look at other options or other perceptions. Okay, so for example, like your friend or your colleague or your supervisor then talk to you yesterday, then some of us might feel, is she angry at me? Does he not like me? Okay, am I not welcome? Okay, for example. Okay, so these are some common unhealthy thinking patterns, but I mean, there's a lot more, but these are some commonly seen thought distortions. Okay, and in order for us to be more aware of all this, whenever you come across a difficult issue, a difficult problem, and you do realize that you're starting to feel sad or you're reacting negatively, or like, you're avoiding people, for example. So take a step back, and ask yourself, hey, it seems like I was sad, I was crying, for example, or I lost my temper at my child. Okay, so why, what happened before that? What was I thinking before that made me feel this way? So try to catch that thought. We always have to take a step back from life or in situations once in a while, just to analyze and see whether did we miss something. Okay, because again, thoughts are occur very naturally. We don't realize until sometimes you might not even realize it, basically. Okay, so take some time to think through what have you been thinking. Okay, and once we're able to do that, we'll evaluate it. Okay, so one of the most straightforward thing to do is to ask yourself to check for evidence. Okay, for example, you mentioned that you're worrying about whether, say that person does not like or like you. Okay, ask yourself, is there evidence to support that, hey, this my supervisor thinks poorly of me? Okay, is there any evidence for and against, and how many evidences for and how many against. So you have a rough figure there, okay, a percentage or a number there for you to justify, hey, whether do I want to believe in the large percentage or the smaller one, okay? And test the logicality of your thought, okay? Is it realistic for me to think that if today I didn't do it right, then I won't succeed anymore at all, okay? And whether you think that you're a failure, is that a logical thought? Are you sure that in so many years of your life, you have never done anything good, okay? Because that might be highly unlikely, isn't it? Okay. And yes, are there alternative perceptions? Okay, this will help for tunnel vision, for example. Okay, ask yourself, are there other possibilities? Okay, did he not talk to me because he's just tired from the long day? Or maybe there are other issues that's bothering him or her that's, in impacting your relationship or your communication, for that person to actually concentrate on what you're trying to say. Okay, so these are some simple ways to analyze your own thought. Okay, basically be your own judge. Okay, your thoughts are your own, but you also want to evaluate your own thoughts. Okay, we try not to believe so easily in everything that we want to think of, okay? Because sometimes we are really the harshest commentators in our lives. We ourselves are the harshest on ourselves, okay? So yeah, be your own judge and evaluate some of the thoughts that if you feel like are really impacting you and really causing some disruptive behaviors, okay? Okay, so here are just some examples that I'll just quickly go through. Okay, so if you ask yourself, if I don't hit my target, if I don't hit the expected goal, I'm done for. Okay, so there are ask yourself, is there evidence or are there other perceptions or solutions? Okay, definitely going to fail, but you don't even have evidence about that because it's in the future. Okay, no one will know what's going to happen. Okay, and I'm a lousy mother. What's the evidence for the fact that you're actually a lousy mother? And what are the evidence against? Okay, so if your kids are happy and healthy, it might not necessarily mean that you're such a bad mother. Okay, yes, we're all human beings, we make mistakes, but it doesn't mean that by making 1, 2, or 10 mistakes, it doesn't mean that it makes us a bad person. Okay, and this one, for example, yes, there might have been other reasons, okay, for him or her to not talk to you. Okay, so you can always try again. If maybe it's true that your relationship is sort of affected, then okay, then we will deal with that. All right, rather than constantly getting disappointed or sad or frustrated about it. Okay. One common method for us to be more aware of our thoughts as well is to do a thought diary. Okay, this will take effort and time and also practice. Okay, a lot of us might not have the time to commit to do this. Okay, but I mean, technology is very advanced these days. There's actually a lot of apps out there, okay, that will help you to key in your thoughts and all that. And a lot of these apps might also have what do you call that, the structure itself ready for the diary. Okay, so basically it's something like this. Okay, when we were young, maybe as a child or so, we might have had fun writing diaries. So this is similar, but we don't have to write like lengthy essays. It's just about helping us to being aware. Okay, especially if, for example, today you have been emotionally affected or something has happened. So it will be a good day for you to jot that down. Okay, if nothing happened today, or if you just want to jot down some happy situation, some happy thoughts and emotions, you can do that as well. But basically, it will help us to see, hey, what happened? Okay, what situation was it that caused us to think in a certain way and to feel a certain way and to behave a certain way? What are the consequences that have come about because of our such behaviors? Okay, by doing so, it will actually also help us to see. For example, if you forgot what the situation is, you can fill up the behaviors or the emotions and the thought. You can go backwards. Okay, so when we fill up the emotions, then we will realize, I felt sad because what was I thinking? Or I was thinking of this, and why was I thinking of this is because of this situation. Okay, so basically this will really help. So we can try it. Some of you can try it if you want to, but if you feel like you need someone to guide you through or to help you to go through it, then you can always seek help, okay, from your mental health professional. Okay, if you notice, some of you notice at the emotions column, there's a number. There's a bracket. In the brackets it says intensity 10 out of 10. Okay, so you can even rate your emotions. Okay, let's say, how sad were you out of 10? Okay, is it 5? Is it 7? Is it 10? Okay, so it will give you an idea of how badly it is that you're feeling, or how happy it is that you're feeling. Okay. Okay. Right. So we have sort of reached the middle point of today's sharing. Remember that if you have any questions, please feel free to comment on the message pane or something, and I will try to address, if any, maybe at the end of the session. Okay. So, all right, now we have a better understanding of depression, and we have a better understanding of how our thoughts, our unhealthy thoughts, can affect our mood and might lead to depression. Okay, and how are some of the ways that we can help ourselves to deal with it, okay, and to be mentally stronger. Okay, but I'll also talk about some of the coping methods that we all can try. Okay, because we always want to try on our own first, isn't it? Before we, if not, then only we will see. If it really it is getting out of hand, then only we'll seek help, professional help. Okay. Some techniques. Okay. Okay. Behavioral activation is a technique that is targeted towards individuals who are depressed, who are demotivated, to do certain things. Okay, because some individuals who are depressed, they might not want to go out of the house. They might stay in bed the whole day. They might not even want to leave home. They might isolate themselves for weeks, for days, for months. Okay, those are some examples of some individuals who are facing more difficult cases of depression. Okay, so behavioral activation works by us setting activity goals starting from a low frequency to a higher frequency. Okay, say for example, this person only goes out of the house once for a month. Okay, now let's see if we can increase that from once a month to once a week, for example. Okay, so set a different activity goal every week. Okay, so this week, go out once a week for grocery shopping. The next week, go out once a week for just for a short jog. Or then the next week, go out for to meet a close friend. Okay, or it could just be simple things like, okay, just running out to buy some household items, okay, like some, for example, soap or something. So make it activities that are easy to achieve, short duration, and maybe within close vicinity, so you don't feel like, hey, if I go too far, then I start to get emotional, I start to cry, or start to worry about certain things that I'm too far away from home. So set it from a low level to a more difficult level. Start to increase later once that you or that person are able to perform that lower level of activity. Okay. Then we have credit lists. Okay, credit lists are basically also a self-help method. Okay, So we can always write a sentence each day to give ourselves credit for maybe something that we've achieved today, daily. Okay, maybe today I managed to get out of bed to shower. Okay, or today I managed to go out for a jog. Today I managed to meet up with a friend. Okay, today I managed to complete that task that I have been, I managed to clean my house, for example, something that I've been putting off for a long time. So accumulate all these credits, then you will have a lot. Okay, so it'll continue to motivate you to take action. Okay, and the same goes for appreciation journal. Okay, every day, complete the sentence for I am grateful for or towards what. Okay, I am grateful towards myself for being able to help an old grandmother to cross the road today. I am grateful for having my pet cat with me, or my pet dog, or my pet rabbit with me for today. Okay, when I'm sad. Okay, so again, when you accumulate it in a month, you'll have a lot. Okay. Then we have some other techniques like problem solving and decision making. Okay, so these might be a little bit more difficult, but always take a step back and weigh your options. There will always be options, but yes, there will not be perfect options. Okay, we always feel like there's no way out because we feel like to us we don't always we always want a perfect solution. Okay, but the thing is, in life there might not always be a perfect solution. Okay, decision A might have pros and cons. Decision B might also have pros and cons. But the idea is we just have to pick the option or the decision that gives us less consequences or less cons. Okay, or if it's the consequence that you're able to handle or deal with, then that's fine. Okay, so we need to weigh out which decision and the impact of making that decision are we able to handle and accept. Okay, as long as we're prepared for it to happen, for that consequence, that it may not be as difficult or as scary as it seems. So do not be afraid to come out of that tunnel, and to look at the things that are outside of the tunnel. Okay, and appreciate the beauty of some of the things that are outside, or appreciate that there are still things that you're able to do. Okay, even though we might not be able to solve the problem 100%. Okay. All right. Further self-help methods are the usual, taking care of your lifestyle, taking care of your physical health. Okay, make sure that we are still focused on giving focus on our self-care. Okay, for I think in the last section on stress management, I also mentioned that when we are very stressed is when we have reached our limits. Okay, so we always need to give ourselves time to take care of ourselves. That's why always in life we need to stop, like say every month or every few months, or even every year, take a step back and ask yourself, have you been taking care of yourself well? Have you been giving yourself time to relax, to go somewhere, to take a vacation, or to still have your me time, okay, or to still focus on your own interests and your own hobbies. Okay, sleep hygiene is very important as well. Okay, a lot of times when we have emotional or mental disturbances, sleep is impacted. Okay, or it could be that it could be both ways. When we are emotionally impacted, then our sleep is affected, and when sleep is affected, it also affects how we feel. Okay, because we're tired, isn't it? So make sure that you're practicing good sleep hygiene. Okay, meaning, for example, make sure you're sleeping at the same time every day. Okay, make sure that you are not doing work in bed, okay, or in your bedroom. So treat the bed or the bedroom as a very sacred place. It's only for sleep. Okay, this is especially if you or someone, you have difficulties falling asleep. Okay, so we want to program our minds to think that the bed is only for sleep. It's not for work. It's not for patting your child to bed to sleep. Okay, it's not for scrolling on your phone. Okay, so try to see if you can do something about it. Okay, um, some of us who are parents might have difficulty separating ourselves from sleeping with our kids, for example. Okay, but try to sleep on, I don't know, separate beds if you can. Okay, because your bed would still be yours. Okay, you can sleep in the same room, yes. Okay, but we try not to jumble everything up and mixing up different stresses. Okay, other sleep hygiene tips will be such as, let's say you want to what do you call that? Start to regulate your cycle again. Okay, last time you were sleeping at 1, you were sleeping at 10, and you're sleeping at 11. So you want to make it a fixed time. Okay, so if you want to sleep at 11, for example, okay, half an hour before, set an alarm and say at 10:30 for you to drink your milk, for you to brush your teeth, wash your face, go to the toilet, make your bed, okay, to change into your pajamas or whatsoever. So give time for that so that you won't come to, let's say you want to sleep at 11, but 11, then when you start doing all those things, then your sleep time will be delayed. Okay, so these are some of the things that might help to to sleep better. Okay, and yes, take care of your health. Our physical health and our mental health is actually largely related. There are a lot of individuals who come in with health issues, high blood pressure, okay, or panic attacks, or gastric issues. Okay, but then after a lot of exploring, then doctors realize that, or physician might realize that, hey, all this might have come about, or low immunity might have come about because you have been overly stressed or you've been overly depressed. Okay, so take care of our health as well. Okay, we need to yeah, pay attention to all that, because if not, then it might also impact how our emotional state, and then our emotional state might go down the hill and it might affect our health too. Okay, so make sure you're getting enough rest, you're eating well, you're drinking well, you're sleeping well, and all those things. Okay, social immersion is also very important. In fact, staying connected with people and being supported by people is actually one of human beings' very basic needs. Is together with eating, drinking, breathing, okay, needing shelter, okay, so needing pleasure, okay, social immersion, social connection, and relationships are also a very important part. Okay, which is why when this is lacking, some of us might feel like, hey, lonely or hopeless in life. There's no goal, there's no purpose. Okay, so do not close doors. Keep trying to meet new people. Okay, or do not close off your uh, do not shut off from your close relationships, for example. Okay, and okay, yeah, find new skills if you want to, find new hobbies. Okay, or you can even try to pick up things that you have actually maybe enjoyed doing when you were maybe younger. Okay, before everything started getting busy with family, with work, and everything. What did you used to enjoy? Do you want to pick it up again? Okay, do you want to give yourself some time to do all that again, to fulfill your dreams? Okay, um, there's nothing as too late. Okay, we can always start whenever we want to, and this falls along the lines of self-care as well. Okay. Okay, so again, if you have any questions, then just feel free to put in the comments pane and I will try to address them later. Okay. Now we will head into the last part of today's sharing, which is how to provide support. Okay, this is also something that a lot of people ask. Okay, when we talk about depression or suicidal ideation, even okay, or self-harm intentions. How do we provide support for even just something as simple as my friend is crying to me? What do I do? Okay. Now, first step, we assess. Okay, do not panic and stay calm. Okay, this is very important. Okay, because imagine if your friend is crying, or your friend is worried, or your friend is so depressed, and you're also worrying, oh no, what to do? Oh no. So that's very bad. How? What to do? You're also panicking. That doesn't help. Okay, it will make that person even more worried or even more sad, or it will help that person think that, oh, I'm actually really in a very bad situation and there's no way out of it. Okay, because if you also cry, also what do you call that? Saying things like, oh, that's so bad, what are we going to do? Then it will make that person feel even more helpless. Okay, so stay calm. And then we want to evaluate the risk of the situation. Okay, I put this in because accessibility to evaluate risk of harm, because a lot of times when it comes to depression, there's always a possibility that that person might want to harm themselves. Okay, so look at whether this person has access to harm. Okay, that could mean, okay, are there sharp objects nearby? Okay, or are they at what floor are they staying in? For example, if your friend has just called you, okay, you wanna check on that. Okay, is there a plan? Is this person telling you that what they are going to do? Step 1, step 2, step 3. Are they telling you all this? If yes, then that would be a high risk. But if no, if they're just saying, I feel so helpless, I feel like there's no point for me living. But if you explore further, but they say, no, I actually don't know what to do yet. I just feel very, very helpless. Okay, then maybe the risk is not that high. Okay, so stay calm, right? And the next thing to do is always to not leave these people alone, these individuals alone. Okay, or if you're also feeling that way, do not try to give yourself a chance. Try to get the emotional support. Remember social connection, that's very important. Try to talk to someone, okay, or call like befrienders hotline, okay, for example. So when we're providing emotional support to someone, there will be a lot of methods, okay. The first one is of course teaching yourself, even if you're also panicking, to calm down and to relax. Okay, I'll talk a little bit about that in a bit. And we need to see whether this person's basic needs are fulfilled. We need to listen, okay, and we need to teach them to cope if that's needed. Okay, so I'll talk about it one by one very quickly. One of the easiest relaxation methods to teach is a deep breathing technique. Okay, you may capture this down on your phone or whatsoever if you want to, but basically when we are upset or we are panicking or we are worrying, we need to take we need to slow down our let's say our heart rate. We need to slow down our breath. Okay, so remember 4, 7, and 8. 4 is the number of counts we want to do to breathe in from our nose. Okay, and then 7, count to 7 to hold your breath. If 7 is too long, you can do 5 or 6. That's totally fine. Okay, it's just a ratio. Then 8 is the number of counts we want to do to breathe out from our mouth. Okay, remember to breathe in from your nose and then to breathe out from your mouth. Okay, so do this in repetitions for maybe 5, 10, 15 minutes, or even half an hour, depending on how much time you have and where you are. Okay, you can always this because it's just breathing, so you can even do it at work. Okay, even in public places. Okay, if something suddenly reminds you of something sad or upsetting. Okay, but remember, breathe in through your nose and then hold, and then breathe out through your mouth. Okay, so this is something we can teach, especially if we see someone crying, okay, someone feeling upset. Okay, ask them, okay, look, let's do it together. I need to calm down as well. Let's take slow breaths together. Follow me. Okay, then you do your counts together. Okay. Then basic needs, make sure our basic needs are there. Okay, so think about it as a comfort kit. Okay, does this person have water to drink? Do they want warm water? Do they need cold water? Are they thirsty? Are they tired? Are they hungry? Have they been exhausted? Because sometimes something as simple as providing water or food, like chocolate, sweets, or something appetizing, it might help. It might make a difference. Even if you don't know what to say or what to do, just ask, hey, do you need some water? Do you need something, just to chew on? Okay. And, do they need a blanket? Do they need a jacket? Okay. Do they need rest? Okay. When you see them, some people might have been so exhausted, okay, especially from work. Okay. Do you want to take a rest? Do you want to go somewhere? Okay. Do you want me to bring you home? Okay. Do you want to go to a room in your workplace to just have a sleep, a short sleep, a short nap? Okay. Right. Then listening. This is the most important part actually. A lot of us feel like we want to jump in to teach them things to do, to tell them, hey, have you tried this? Have you tried that? But no, try not to jump into that so quickly. When someone is very emotionally affected, let's try to listen. Okay, and by listening, these are just some techniques. Okay, we paraphrase. Okay, to show that we were listening, and then we are trying to clarify and see if we were correct. Okay, it shows this person that someone is finally listening to what I'm trying to say, rather than telling me to do this and do that. Okay, so you were saying this and that, am I right? Okay, and then we try to reflect, like, oh, hey, I see that you're crying, you seem to look very upset when you're talking about this and that. Okay, so it shows that someone finally noticed that I'm sad, this person is sad, or someone has finally noticed that I'm unhappy and I'm angry, I'm tired. Okay, so pay attention and listen and listen actively. Okay, and then we can try to validate and tell this person that, hey, you're feeling this way, it's very normal. Okay, it's very normal to feel inferior or lesser of a person, lesser towards than other people. Okay, then they might feel like, okay, I'm actually being hurt right now. Okay, all right. And last but not least, after you have done all those things, you have helped this person to relax, you have helped to provide some basic needs, you have helped to hear that person out. Then you can ask, hey, is there anything that I can help with? Do you need help? Can I help? Okay, then you can do all those simple things again: problem solving, decision making. What are your options? Remind them that there might not be a perfect solution, but there is always the best one that we can pick out, the few that we have. Okay. And yeah, how can you help? Do you need to help them to communicate how they feel to someone? Okay, this is if you are very close to this person. Okay, and what are some of the ways you can discuss? What are some of the ways they can help to express themselves to the person who is causing them the stress, for example? Okay, so basically, there was some things that you can do. Okay, after you've done all that, and if from the very beginning, if immediate harm was present, then you might need to immediately jump to reacting. Okay, get help. Okay, because we have limitations to what we can do. Okay, get help if, for example, if that person is injured. Okay, contact authorities, contact family members. Okay, but if there's no immediate harm, again, remember, assess for the risk and the plan. Okay, if there's no immediate harm, okay, hear that person out, do everything in step 2, the step that we previously talked about. listen out and everything, because sometimes when we just listen, it does wonders. Okay, that is the only thing that people need sometimes. Okay, to be heard, to be acknowledged. Okay, and then encourage them to seek help from mental health professionals. Okay, encourage them to talk to someone. Okay, if not, even talk to family members. Okay, but when you need to, if that person is, conscious, or that person is present with you, it's not, in immediate harm, be careful about informing family members. For example, if it's your friend, or if you know this person and you know this person's wives, husbands, partners, for example, be careful about that. Discuss with them whether they are ready to disclose this issue to, their family or someone whom they are close with. Okay, if not, then encourage them to just seek help from a mental health professional. Okay, that might be the better way. Okay, all right. So lastly, remember to take care of yourself. Okay, know your limits. If we have someone around us who have been depressed for a very long time, and they always call you to talk for hours and hours, and or when something happens, they call you to come over to support them. So make sure that you know your limits and take care of yourself. Okay, we are offering them a float. Okay, we are throwing that for this person who's drowning, we're throwing them a float, a form of support, but don't go and jump in if you can't swim. Okay, so don't drown yourself instead. Okay, so if anything, you can even say that I realize that we've been talking about this issue for a long time and it seems like it's really affecting you, but I feel like I can't really help. But how about if I help you to look out for mental health professionals who will be able to help you instead? How does that sound? Okay, so recognize when you already reached your limit, and if a lot of us don't have so much time to constantly spend time with people who might be very draining to us. Okay, so I'll end with this. Remember that sadness, okay, or depression, all these are very natural responses to difficult situations, to stress. Okay, if you feel like you're depressed, try not to be so harsh on yourself. Okay, see that as a normal thing. Okay, it is resilience. We are all human beings. We're allowed to feel messed up inside out. We are allowed to feel that we are not as not as strong. We're allowed to feel that we are incapable, and that's totally fine. Okay, if we can't perform certain things, it's fine. It just means that we're human. Okay, we have limits sometimes, and it might certain things might occur to us that will pull us down, and if it occurs to any other normal human being, they might also react the same way. They might react worse than you. Okay, they might deal with it worse than you, or they might deal with it better, but it doesn't mean that they are also not impacted. Okay, so I'll just end on this as a positive note for all of us to acknowledge that we have limitations, but we also have strengths. So focus more on those strengths to build up on our limitations, okay, or things that we can't do. So use our strengths to help us move forward, okay, rather than focusing on mistakes or things that we haven't been doing well. Okay, so thank you all for tuning in. Again, if are there any questions, then if not, I'll pass back to our moderator, Ms Felicia. Okay, these are my clinic hours. If any of you need to reach out, feel free to, don't be afraid. But otherwise, I'll just pass the mic, the time back to Felicia, Ms Felicia, to help me, close this up. Okay, thank you.
Depression is a common mood disorder that affects individually, emotional, cognition, and behavioral. Thank you for Ms. Kang for the sharing today. So stay tuned for our next series. Our next Series 3, the topic will be the taking control on the anxiety on next Friday, 26th June. So have a nice day, everyone. Thank you for tuning today.